Sleep WA offers a holistic range of sleep services for all sleep disorders. So we manage people from insomnia, circadian rhythm disorders. They're problems with your biological clock. So you might have a clock that's set a few hours early, or a clock that's a few hours late, or a free running clock. So we can manage those problems using novel therapies. We look after people obviously with snoring and obstructive sleep apnea. We look after people with shift work problems who have difficulties sleeping during the day. So we are able to provide a holistic service for all the sleep problems that you're likely to encounter. Well, that can sometimes be determined on the nature of the referral that we get from your local doctor. So if the problem appears to be predominantly snoring sleep apnea, we can generally tell you what we need to do before you come and see us, and therefore reduce the amount of time and effort it takes for you to get treatment. Sometimes, however, it's best to come and see a sleep physician so we can then determine what services or what we need to do, what therapy we need to do before you get here. But to save time, it's useful for us to get a sleep study in some patients before they see us because it saves a consultation. Sleep WA offers a broad range of sleep expertise, management and investigation. We're not just out there looking at people with sleep apnea or snoring, and even the people out there doing that aren't doing it particularly well. So we want to make an accurate diagnosis. We want to treat all of your sleep problems, take those sleep problems in connection with all of the rest of your history, as only a doctor can do, because you might have high blood pressure, type 2 diabetes, depression. All those things have an impact on your sleep, and your sleep has an impact on all those other conditions. So we can offer a broad range of expertise and treatment to make sure you get the best outcome. A sleep study is an investigation where we monitor parameters at night. Now, it can be a limited study where we're only monitoring your oxygen level, breathing and heart rate, or it can be a more comprehensive study where we're measuring brainwave activity, eye movement, leg muscle activity. As to which type of study you need depends on the presentation. For instance, if you have a high probability of having sleep apnea, i.e. you snore, your partner's witnessed periods of apnea, you're overweight, you're more than 50 years of age, then it's quite legitimate to do the study at home as long as there's no comorbid problems going on like heart disease, chronic obstructive lung disease, morbid obesity. In those patients, we prefer to do the study in the laboratory because it's slightly more accurate and we get better quality data. The problem with doing it in the laboratory is the price you pay for that more accurate study is the inconvenience of sleeping in the laboratory. So what we find is when you have a home-based sleep study in your own environment, you might sleep a little bit better. You suffer a little bit in terms of the diagnostic accuracy of the test, but that doesn't matter if you've got a high risk of having the disorder because we generally will pick it up, versus a lab-based study which is probably a little bit more accurate. The services in the laboratory are certainly covered by private health. You will need to check with your private health insurer to make sure you don't have any excess. But generally, for instance, if you have cover with HPF, the investigation in the laboratory is fully covered. Outpatient services currently are not covered by private health. There is a small gap on most of the tests that we do, but the majority of the cost is actually covered by Medicare.